Hello friends, welcome to my channel. My name is Okafo Luke. I'm a clinical pharmacist, pharmacy director. Today we want to talk about drug abuse, breaking the chains of drug abuse. We want to talk about know what drug abuse is, check for its substances that are commonly abused. We're going to be talking about the causes of drug abuse, and we are going to be talking about the effects drug abuse has on the abusers, and then find out ways to prevent the incident of drug abuse. Drug abuse refers to the hazardous or injurious use of drug or psychoactive substances, including illicit drugs and even the prescription drugs. It's common to see children these days, they mix up cough syrup with other substances and drink it outside the required mode of administration and even the amount required to take care of something like that cough, of which that medication is meant for. I want to look at what that does to them. We are talking about it involves constant consumption of drugs of abuse, notwithstanding the negative consequences or the harm that those drugs do to the system. Drugs of abuse can lead to dependence and drug addiction. Actually, the drugs of abuse take over the life of the abusers and control them to the point that any time or any day they don't have those substances of abuse, they feel that they have not achieved much, or they have not done anything useful to themselves for that particular day. So these are the preventable. It's a preventable evil that is against quality life and healthy living. Let's mention some of the substances or drugs that people actually abuse. They include marijuana, cocaine, opioid, and the commonest one is alcohol. They mix it up with other substances. If they drink it alone, it's even relatively acceptable. They mix it up in a way that to bring addiction or hunger for it into their system. There are causes why people engage in drug abuse. Some of the causes is genetic predisposition. There are environmental factors such as children who are exposed by their parents to drug abuse in the family. They are also what's called influenced by friends or peer pressure. There are socioeconomic factors that has to do with unemployment or those who are not educated. It's suffice to say that even among the educated today, they engage subtly into drug abuse, and before you know it, it becomes a challenge to their life and healthy living. There is also what is called depression. It's part of reason why, and anxiety is part of reason why people engage in drug abuse. I want to find out the effects of drug abuse. Drug abuse has physical health consequences and mental health consequences. There are social or economic factors that bring drug abuse to the point of detriment to the abusers. Some of the physical consequences, some of the physical health consequences. Drug abuse can cause stroke, can cause cancer, can cause lungs or heart diseases or disorder. Then the depression itself that is, and anxiety while people engage in drug abuse can equally promote recurring depression and anxiety into their body. Another consequence of drug abuse is paranoid. This paranoid is a case that can trigger psychotic disorder, manifesting form of schizophrenia. There are social and economic factors that make drug abuse dangerous engagement activity by novice or the abusers. It can cause their inability to meet financial responsibilities. It can cause job loss. There are cases where homes are broken, relationships are broken. Why? Because there is a person or persons in that family involved in drug abuse. Let's talk about preventive measures. There are ways we can prevent drug abuse. One of them is to encourage people to, when they cite the drug, let them have that boldness, resistance to say no by building skills to resist drugs when offered. Strengthen the personal commitment and reinforcing attitudes against drug abuse. Let's have that personal that power to say no when you need to say no. The effective prevention measures include measures that can be carried out through, we start then in the schools. We engage schools in the preventive drug abuse prevention programs. We engage community outreach by creating awareness, drawing an awareness campaign through various media. Then we support high-risk population that always engage in drug abuse. The high-risk populations are mostly youth and even the so-called musicians and some celebrities, so to speak. Understanding drug abuse is the first step that we need to combat this global challenge. We need to promote education. We need to get involved in breaking chains of drug abuse through providing support to those who are already into it, and then discouraging those who are not yet into it to stay away from it because of the deadness or the consequence or deadly consequence of drug abuse. Together, if you or someone who you know is struggling with drug abuse, I want to let you know that together we can drive away or bring to nothingness the effect of drug abuse in our society. Many thanks for joining us today to spread awareness and work towards a world that's free from drug abuse as we break these chains of this substance abuse. Stay informed and stay empowered.